Vulvovaginal atrophy is certainly a condition that is secondary to menopause, in a way to the drop of the estrogen level, but also to the aging process. So vulvovaginal atrophy is a common condition with a great impact in quality of life. Almost 2/3 of women has a decreased self-image and self-esteem, and almost in half women there is an impact on a relationship with the partner. The procedures can be performed by gynecologists in the outpatient setting, and it takes 5 minutes to do it, and you can go home immediately after the procedure itself. The procedure won't cause any harm or any pain. The majority of women didn't feel any uncomfortable sensation at all. The procedure will take between 3 and 5 minutes, depending on severity of atrophy that you may have. As an average, the length of the duration of treatment is 12 months. You will see the results very soon. After 2 weeks, you may record an improvement in the trophism of your genital tract by the first 2 weeks, and there will be then an increase in sensation of improvement, and particularly after the second or third treatment, where we can use the best setting, the results will be much more evident. There are not many limitations actually after the treatment itself. You should not have a bath within 72 hours since the procedure, as well as we suggest to avoid sexual intercourses in the 3 days following the procedures. MonaLisa Touch is certainly appropriate for women complaining of vaginal dryness. Vaginal dryness secondary to many different conditions, such as menopause, first of all, but also women who have this problem secondary to treatment for different types of cancer, breast cancer, cervical cancer. Vaginal dryness obviously is one of the most important symptoms, but it's usually associated with pain during sexual intercourses that improves as well and in parallel with vaginal dryness. MonaLisa Touch is certainly the procedure that has the best evidence in medical literature, showing how safe and how good it is. Other lasers still have to produce that evidence, and each single laser is completely different from the other. So we cannot actually say that CO2 laser can produce the same effect on your symptoms with the same safety. MonaLisa Touch is used worldwide. Nowadays, it's used in US, in South America, in Russia, in the Middle East, in Korea, in Singapore, as well as in Europe. There are many different countries in the European communities where this procedure has become a routine practice for treating postmenopausal symptoms related to vulvovaginal atrophy. The cost of the procedure should be discussed individually with your doctor, with your physician. And in terms of reimbursement, at the moment in UK, insurance do not cover the procedure itself, but there are some specific cases where that could happen. MonaLisa Touch can be also useful to treat different vulvar conditions, and I'm mentioning, for example, the vulvodynia secondary to atrophy, where we use a specific setting for the external genitalia. MonaLisa Touch can be used also for lichen sclerosus. There are different data coming from different units demonstrating a good effect on an improvement in the lichen sclerosus. I recently also participated in a study that has been published recently on vulvodynia, pure vulvodynia, where MonaLisa Touch was used, and we recorded an improvement of 65% of cases.